And the short answer to that million-dollar question is yes. Medicare does cover a number of vaccines. In fact, the Department of Health and Human Services published a study indicating that Medicare's vaccination rates for COVID-19 were associated with approximately 39,000 fewer deaths among Medicare recipients nationwide from January to May. But what's tricky is that some vaccines are covered under Medicare Part B, while others fall under Medicare Part D, and this can affect how and what you will pay for them. I'm Danielle Roberts with Boomer Benefits. Let's first take a look at which vaccines fall under Medicare Part B. There are 4 vaccines that Medicare Part B will cover in full if your doctor or pharmacy who is administering the vaccine accepts original Medicare. Influenza. Medicare covers an annual vaccine given before or during the flu season. Pneumonia. Medicare will pay for 2 pneumococcal injections when they are given at least 1 year apart. Hepatitis B. Medicare will cover hepatitis B vaccines once, and this is administered to you in 2 to 4 shots over 6 months. And finally, COVID-19, no surprise here. COVID-19 vaccinations are covered, and the FDA has now approved the Pfizer vaccine as well. These vaccines require 2 doses spread out over a 3 to 4 week period. Medicare Part B will also cover other vaccines on a case-by-case basis. For example, Part B covers vaccines that you may need if you are exposed to a harmful bacteria or virus. If you step on a rusty nail, Part B will cover a tetanus shot. If you are bitten by a rabid animal, Part B would cover a rabies shot. Now, let's talk about shingles vaccines, as these are covered very differently. The shingles vaccine falls under Medicare Part D, which means it is subject to the deductibles and coinsurance of your individual Part D drug plan that you have enrolled in. Each Part D plan has its own drug formulary, which lists the medications and vaccines that the plan will cover. But plans are required to offer at least one of the shingles vaccines, which are Shingrix and Zostavax. However, many Part D drug plans have a deductible as high as $480 in 2022. If you have not yet met your deductible, you may pay for all or part of the cost of your shingles vaccine. And if you have met your deductible, then you will still have to pay either a copay or a coinsurance amount for the vaccine, depending on where the drug falls within the plan's formulary. Best case scenario, if you are still working and won't be enrolling in Medicare just yet, get the shingles vaccine when some of you are still covered by employer coverage, and you may find that you pay quite a bit less for it. Lastly, if you're enrolled in a Medicare Advantage prescription drug plan, then you will want to check the plan's summary of benefits and the plan's drug formulary to determine which vaccinations are covered by the plan and what copay or coinsurance amount that you will then pay for them. Medicare Advantage prescription drug plans typically do cover vaccines for flu, pneumonia, tetanus, hepatitis A and B, and measles. Folks, don't forget to hit that subscribe button so we can keep you up to date on everything Medicare throughout the year. And if you want to learn more about what Medicare covers, check out this video next.